All right, let's get this recording started. Well, hello and welcome to the tutorial about the Cost Effectiveness Toolkit for Collegiate Recovery Programs. My name is Castedo de Martell, and I am the President-elect for the Association of Recovery in Higher Education. I'm also a doctoral student at the UT Health School of Public Health in Austin. And I used to be the director of the Center for Students in Recovery at UT Austin, which is where I got really involved in the collegiate recovery world. I developed this cost effectiveness toolkit as part of my Master's of Public Health thesis project. And part of that project was to create a publicly accessible toolkit for all of you to use, and I hope you find it helpful. I did present this at the Association of Recovery in Higher Education conference back in June. But even though that was an extended session and we had 75 minutes together, it still wasn't really quite enough time to really dive in to how this tool works, all of the different numbers that go into this tool, and how you can really effectively use it in your advocacy efforts as you try to gain support for your collegiate recovery programs or just take your CRP to the next level. So what I wanted to do with this tutorial is to really give it the time that it needs. At any point during this video, feel free to pause, feel free to rewind, feel free to fast forward. There's definitely detail in here that you will not need in order to be an effective advocate for your CRP. You can still use this toolkit, but skip over some of kind of the background materials. And really probably about the first half an hour to 45 minutes is going to be background about the model upon which the tool is built. So if you want to skip that, if you feel like that's just going to make your head spin and it's not going to be super interesting, go ahead and skip it. Don't even worry about it. And you can get right to the part where we really walk you through how to use the tool. If you have any questions, don't worry, I'm not going to leave you without giving you my contact info and a bunch of resources that will hopefully help to answer some questions, even if you can't quite reach me by email. So let's go ahead and get started. I'm gonna walk you through this PowerPoint first. This will look familiar to you if you were at the ARHE conference in the summer. If you weren't, this will be new for the first time. You can download these slides, you can download a handout, you can download the toolkit and a bunch of other tools at the some links that I'm going to give you towards the end. I also just wanted to give a plug to let you know that this is the first in what we hope to be a series of additional tutorials and toolkits that we'll be putting out as the Association of Recovery in Higher Education to help, to really help spread the word about collegiate recovery, help you become more effective advocates. If there are any specific tools that come to mind that you think might be really helpful, that you've been really hungry for, just send us an email, recovery@collegiaterecovery.org. We would love to hear from you. We'd love to hear any feedback about any of our existing tools that you might have used, including this one. Let us know how it went for you. Let us know how you were able to use it and if it was successful or if it could be improved in any way. We're always happy to hear from you. Okay, so let's get started. So just to give you a brief overview of the layout of this presentation, first I'm just going to talk a little bit about what the point of a cost effectiveness analysis is, why I wanted to do this work, what the background of this project is. Then like I said, I'm going to walk you through kind of the model that underlies the toolkit. So that model is the basis of the comprehensive cost effectiveness analysis. So that's kind of really the academic portion, right? And then the toolkit, that's where we're really going to dive into the practical portion, the portion that I hope you get to use as you advocate for your CRP. And of course, questions. This isn't interactive in this version, but I do invite you to please feel free to reach out and ask any questions that you might have. And again, I'm going to give some helpful links if you have an interest in reading any further. So first, let's talk about the point. The whole point of this project is really to be able to answer the call for greater accountability that funders and administrators want us to have. They want us to be engaged in institutional assessment. They want us to be engaged in program evaluation, but it's really hard to evaluate or to assess innovative programs like collegiate recovery programs. It's also really challenging to evaluate programs that are really based in communities, that are based in peer support. It is not the same thing as evaluating a randomized controlled trial, right? This is not some clinical trial where it's really easy to separate people out and keep them separated and, you know, put in all sorts of different experimental controls. This is on purpose, a naturalistic setting where we want people to be engaged in their everyday life, relearning how to live, right? We want to be able to support them in as naturalistic of a setting as possible. And so that makes it really tough to do the kind of rigorous evaluations or even assessments that, that our higher ups want us to do, right? It's also really challenging to measure what we know matters, right? We know that this is about a lot more than relapse rates. We know that this is about a lot more than number of days spent sober. This is about changing the quality of your life. This is about opening the door to opportunity. This is about somebody being able to engage in a normative college experience sober and to have those really meaningful and transformative life experiences and to be well supported in that. Now, how do you measure that, right? We've got some great tools like Recovery Capital. Of course, there's quality of life assessments, but all of that stuff, it's just challenging. It's complex, and so it can be a real undertaking for somebody who's already juggling the ins and outs of running a program and meeting the needs of those students. So I wanted to make that a little bit easier for you. And the other pressure point here, the other real motivator here, is that some of those calls for assessment and evaluation really circle around money. They circle around resource use, around the efficiency of a program. And math is intimidating for a lot of people, and math about money can be doubly intimidating for a lot of people. And math about money, especially like health economics, it is not always the part of the standard education for a lot of collegiate recovery professionals. There is no standard education for collegiate recovery professionals, first of all, right? But a lot of us come from social work, we might come from health education, we might come from counseling background, something like that. And you're not necessarily learning how to do these kinds of efficiency evaluations when you're getting those kinds of educations. Even if you're really, there's plenty of people in the CRP world with PhDs, you're not necessarily learning how to do these kinds of analyses, and nor does it necessarily make sense for you to be an expert in this stuff. But decision makers, they tend to care a lot about resource use efficiency and efficiency evaluations. And so I wanted to make this a little bit easier for you to do and to really kind of lower that barrier to entry to make these kinds of cases. And just some background on the project itself. I finished it in May of 2019, or actually really March of 2019. And it was part of my MPH thesis work. It's IRB approved. I actually got some really great assistance from some folks that you may know from the collegiate recovery field, Emily Eisenhart and Dr. Jeff Jones from Georgia Southern University, and Kristen Harper, who was with Transforming Youth Recovery and is now with C4. Both of them had collected data from a sample of as many collegiate recovery programs as existed at the time of their surveys. So I was able to use their data to kind of form the base of this analysis. I also got a great data set from the National Orientation Directors Association, which is usually behind a pretty significant paywall. So I definitely want to acknowledge and thank them for sharing that with me for free. Also want to shout out my great thesis committee, Dr. Andrew Springer and Shelton Brown from the School of Public Health, and Lori Holler-Steiker from UT Austin. So next, I'm going to walk you through kind of the public health case for why we need collegiate recovery programs. You already know this, right? You have had to make similar cases, similar pitches, but this is really the health economic case for collegiate recovery programs. So maybe some of these same citations and kind of this argument thread might be useful for you in your advocacy work. If it is, great. Feel free to kind of revisit this and pull whatever citations you need. All of those citations are at the end and on a link that I'll give you at the end. But if you really feel comfortable with this stuff and you want to skip it, go ahead, feel free to skip ahead a little bit. So we know that there's 19.7 million Americans with substance use disorder in 2017. That's just over 7% of the population. Of those, 14.7% of the total college student population have a substance use disorder. And that translates to $442 billion cost to society as the result of substance use disorders. And importantly, we actually have a really cool opportunity to affect change on college campuses simply because so many people in this country attend at least some college. It's actually the majority. Just under 60% of American adults attend at least some college. And every year, roughly every year, at least in recent years, just over 40% of young adults enroll in college each year. And again, we've got a really high prevalence of substance use disorder among those college students. And we kind of have this captive audience where there's a ton of our population in this country who are on those campuses and affected by this issue. We also know that very few receive help for their substance use disorders, and those that do receive help, they're returning to really challenging environments. College campuses, we know they've been called quote unquote recovery hostile environments. Is a terminology we tend to use in our field. A big part of that recovery hostile environment has to do with those outsized perceptions of substance use. This chart is from the National College Health Assessment data. What's in blue is the perceived use among college students, so what college students think their peers are doing. And in yellow, we have actual use, so what college students actually self-report anonymously that they're doing. And as you can see, the perceived use is just totally out of whack with actual use prevalence, and particularly for drugs like marijuana, like cannabis. That disparity is even greater than it is with alcohol. And so that can really lead a student who has actually gotten help, one of those few 7% of students who's actually gotten help for their substance use disorder, it can lead them to feel really isolated, really kind of on the fringe, really like they don't have a place on campus or like they don't belong on campus. as many of you know, I know that personally, right? I certainly was one of those students and before I found collegiate recovery. And so that's where we have this opportunity here. Treatment is really costly. It's anywhere between $15,000 and $22,000. That is for kind of more publicly funded average treatment centers. I think we all know that cost can go way high if, say, for example, you want to go to a very luxurious one, maybe out in Malibu or something. It could be as high as $100,000. You could really pay any amount for treatment. But kind of the average range that we see around the country is somewhere between 15 and 22,000. Repeat treatment episodes are very common. Actually, greater than 63% report at least one other previous treatment episode, and then 15.5% report 5 or more treatment episodes, and that's just in any given year of people entering treatment. So that those costs really rack up pretty quickly. If you're thinking about somebody accessing something that costs on the low end $15,000 a pop, and you're accessing that resource 5 or more times, this is a really expensive disease to take care of. We also know that this is an increasingly deadly environment in which to use, and in which there's any use, right? So whether we're talking about problematic use or whether we're talking about occasional use, when you're talking about any kind of street drug, we have a particularly challenging and deadly environment because of that influx of synthetic opioids into a lot of the supply of street drugs. So we're seeing this call for this even greater call for protecting people's recovery so that they don't end up in a situation that's potentially fatal, let alone costly. So we want to protect recovery. We want to protect recovery in these really challenging environments like college campuses, actively recovery hostile, right? And we want to do so early, right? So we can interrupt some of these repeat treatment episodes before they even get going, so we can prevent them from ever happening. So that's where we get our solution. Collegiate recovery programs offer a potential solution. Their services offered by institutions of higher education, centered around a community of students in recovery from substance use disorder, supported by staff, physical space, and programming. And what we see in collegiate recovery programs, again, many of you already know this, but what we see is a really greatly reduced relapse prevalence among people who participate in these programs compared to the general substance use disorder population who may be exiting treatment and may or may not have that additional support post-treatment. So collegiate recovery programs, we see only an 8% relapse rate among those students. That's from that Laudet study from a few years back. Compare that to 40 to 60% among the general population of people with substance use disorders. We also see that lower prevalence preserved after graduation. It's about 10%. And that's from a great study of collegiate recovery program alumni done by some collegiate recovery program alumni, Austin Brown and Robert Ashford, and some other great folks. While we have this wonderful solution, and we are seeing this solution proliferate across the country, we've actually seen some really rapid growth in recent years, from about 29 programs in 2012 to 184 in 2017. It's wonderful that we have this explosion, this proliferation of collegiate recovery programs, that people are really seeing the value and seeing how these tools can be used to address that exact public health challenge that I just described. We have some serious gaps. And one of those major gaps is in our existing body of knowledge about collegiate recovery programs. So let's talk about where that gap is. So again, this goes back to the need for assessment and evaluation activities. The pressure is on from funders in every corner, from our supervisors, from our administrators, from legislators, and other decision makers. They want to see that these work, that these programs work, and they want to see what the value of these programs is. And so when we do evaluation activities, we tend to think about this in terms of a hierarchy. And this figure is adapted from Rossi, Lipsey, and Freeman, a really great foundational textbook on evaluation science, which I highly recommend if you are being tasked with doing a lot of evaluation for your program. Gives you a great primer on how to do really rigorous evaluations. And then you can adapt that to the level that your institution's asking for. So you always want to start with some kind of needs assessment. And we actually have, I've put citations in for each tier of these. We actually have some great needs assessments. We have monitoring and surveillance of campus substance use patterns, and we have several national studies that really help us kind of understand what those gaps look like. And I cited some of those in the public health case in the introduction there. We also have actually really tons of great writings on how these programs work theoretically, how they're designed, what some best practices might be. So we really have a good, solid theoretical foundation as well. And there's plenty more I could cite, but I just picked out one key one. And we also have lots of process evaluations. So lots of descriptions of like, hey, here's how many students we could reach. Here's how these programs are delivered, and here's who they reach, and here's really the who and kind of the how of this program, right? We have some outcome or impact evaluations, and that's really looking at, okay, so we know that we need these programs. We see kind of what they're putting out, what the output is. Now, what kind of actual impact or goal achievement do we have from these programs? So for that layer, we have quite a few. However, most of them tend to be at just one institution or maybe a handful of institutions at a time. We've got very few nationwide outcome evaluation studies. We get a little bit from that Day study from a few years ago, looking at those national relapse rates, and then the alumni outcome survey as well. But we could definitely use some more work there. However, that area is definitely way more developed than the next area I'm going to talk about, which is efficiency evaluation. Efficiency evaluation refers to how we're expending resources to achieve everything else underneath that pyramid, right? So how are we achieving those outcomes? How are we achieving the coverage and delivery that we're measuring in the process evaluation? What are we spending to get those kinds of results, right? And inefficiency evaluation, that we put that at the top of the hierarchy because you really need to have all those other pieces figured out before you can even do this, right? And so what we'll see is that, what I was able to design to do the first ever efficiency evaluation of a collegiate recovery program, what I was able to design is pretty basic right now. It really is, because again, we have limited national outcome data. However, as that develops, as we get a better handle on really what the national landscape looks like as a whole, then we're going to be able to refine we're going to be able to refine the current model that I have built, and we're going to be able to do other types of efficiency evaluation. That efficiency evaluation, it's also limited, frankly, for a lot of different types of substance use disorder and especially recovery services. You don't see a ton of literature around efficiency evaluation in in journals like Addiction and other places. It certainly does exist, but it's just not nearly as well developed as some of the outcome evaluation studies. And again, it's the smallest part of the pyramid. It's at the top of the hierarchy. It's so dependent on all these other pieces being pretty well developed that, of course, it does come a little bit later. But it's a major gap. It's a really critical gap in our evaluation literature. So I wanted to make sure we had the opportunity to fill that and to do so in a way that I'd be able to share that with you. So the purpose of this study was to fill that efficiency evaluation gap with a cost effectiveness analysis of a CRP. And in a cost effectiveness analysis, what we're doing is we're determining the cost per unit of some kind of developed, or of some kind of desired health outcome. And we're going to compare that to some standard of practice like treatment as usual or some other threshold. And don't worry if that went by quickly, we're going to talk a lot more about exactly what that means. So a quick note on that top tier efficiency evaluation, there's a bunch of different ways that you can evaluate efficiency. Cost effectiveness analysis is not the only one. Cost benefit analysis is probably one that you've heard of. Return on investment, probably another thing you've heard of. Cost utility analysis, you probably haven't heard of that. That's fine. And then cost effectiveness analysis, you may have heard of it. The basic breakdown I can give you is that for some of these methods, we're assigning a cost to, or a dollar value to both the costs and to the benefits side. So the benefits being, I get to go to college, I get to, have these opportunities, and I get to greatly improve the quality of my life. Well, how much does that cost? That can be a little tricky to figure out. And I would say that we're kind of in the pretty toddler stages of figuring out what that really looks like for people in recovery, right? What that dollar value might look like for in the lives of people in recovery. And so cost effectiveness analysis, one of the great advantages of that method, as opposed to these other methods, is that it actually doesn't ask you to assign a dollar value to that benefits side. So what we're doing instead is we're taking into account all of our costs, and then we're dividing it by our units of benefit. And again, we'll get into that a little bit more, but we don't have to assign a dollar value to those benefits. Instead, we can just say it adds one great year of life, and here's how much it costs to add that great year of life, essentially. All right? So again, the public health significance of doing this study. So we want to reduce relapse. We want to reduce the repetition of costly treatment episodes. We want to reduce those overall costs to society. We want to answer this question: are CRPs an efficient and cost-effective intervention to achieve that goal? Now, a quick caveat: as we go ahead and try to answer this question, and as you try to answer this question for your specific program using this toolkit, it's really important to keep in mind that we do things all the time that are not efficient, that are not cost effective, that cost way too much money than we really should be, quote unquote, should be spending by whatever thresholds we normally use. We do it all the time. And that's because we've decided as a society, as a community, as a campus, at whatever unit level, that it's worth it. So even if it's not technically economically sound, we make uneconomical decisions all the time. So don't worry about that too much. I will say, spoiler alert, you would have a really hard time not having a pretty cost-effective program, even if it's just a theoretical proposed program. These programs, by and large, are not just cost-effective, but totally wonderfully cost-saving. But I do want to give that caveat. We make decisions all the time to act not in our economic favor and not in line with what best economic advice would be, because we're human beings and we get to make those kinds of value judgments about what we want to spend our money on and how we want to spend it, and that's totally okay. So yeah, just important caveat. Okay, so again, objectives here, we're determining if CRPs are cost effective. We're going to compare that to two thresholds. So the thresholds we've chosen are the $50,000 standard, and $50,000 standard is, it's actually related to the cost of dialysis. So because in this country, in the US, we cover dialysis under publicly funded healthcare, and we've made that determination as a society years ago. That is a standard cost effectiveness threshold that we use here in this country. And that threshold is $50,000 per additional life year. So anything under that would be considered cost effective. Anything over that would be considered not cost effective, right? And that is a pretty steep price tag, right? But that is what we've that is what our government has demonstrated that it is willing to pay for an additional life year, essentially, right? And then treatment as usual, or TAU, that's what that acronym is. That's the second threshold that we're going to use. And treatment as usual, if you remember back to an earlier slide, it's a ballpark between $15,000 and $22,000. So that's the cost of those repeat treatment episodes. We're using that as a proxy for treatment as usual. There's a million other costs that you could bundle in there, but a very simple way to conceptualize that second threshold is just, what is the cost of a repeat treatment episode? And if we can avoid that and hit under it, then we're meeting our second threshold for cost effectiveness, right? And we're going to look at that. We're going to determine that from two different distinct perspectives. The first is the societal perspective. So that is the U.S. as a whole, U.S. taxpayers, governments. You'd want to use this perspective if you're talking to legislators, civic groups, anybody outside of a university, essentially. And the second perspective, what we typically call this in cost effectiveness or health economics circles, what we call this perspective is actually the healthcare system perspective. However, when we're talking about collegiate recovery programs, when we're talking about college students with substance use disorders, the healthcare system is the institution of higher education in this case, because we're tasking that institution of higher ed with that decision to adopt or not adopt a CRP, right? That's really where this decision point is, and where this, and who needs to know this information. So they're taking on that role of the health system's perspective. So we're going to instead use the term institutional perspective. That's what we're going to call it for this. So the institutional perspective, and I actually have that broken out into A and B. We'll talk a little bit more about what each of those mean. But A is 99% of you are going to use A. B, probably almost nobody's going to use it, but it is there as a very conservative additional estimate if you want to use it at any point. Okay? The second objective was to create and disseminate a cost effectiveness toolkit for CRPs, allowing you to use your user supplied data. So let's get into the analysis itself. Again, pausing here to say, feel free to skip this. If you feel like this is going to make your head spin, or you don't really feel like you need to know this, totally okay to skip this. You can still use the tool without this, but this may help you use the tool, okay? So to do a comprehensive cost effectiveness analysis, we use three basic methods. We build out kind of a base model or base case scenario. Then we do one-way sensitivity analyses. And basically that means we take one variable at a time. We allow it to vary across the entire range of potential variation. And then we redo the analysis for each of those points of variation, and then we repeat that for each variable. And then multi-way sensitivity analysis, where we're basically doing that, but with all the variables all at the same time, and it's a little crazy. All right, so let's talk about the base case first. How is this model built? What's the math that goes into it? Really important quick caveat here. This is actually all very simple math, I will say. Everything in the base case, everything in the one-way sensitivity analyses, all super simple math. However, it's stacked on top of each other in a really complex way, and that's what makes it a little bit head spinny. So don't worry about it too much. Feel free to rewind as much as you need, pause, go back and forth, whatever you need to do. But it's really just addition, subtraction, multiplication, and division. So the basic formula for cost effectiveness analysis is you're taking the cost of the intervention and you're subtracting out the cost of treatment as usual. Then you're dividing that by the difference between the intervention effect and the treatment as usual effect. Now that numerator, that difference between the intervention cost and treatment as usual cost, that's called your incremental cost. That difference between the intervention effect and the treatment as usual effect, that's called your incremental effect. And your result, the key number that you care about, is called the incremental cost effectiveness ratio, or ICER, or ICER. And what it means, here's how to interpret this number. It's going to give you a dollar amount, and that dollar amount is the cost per one unit of your health outcome. So let's just give a really simple example. Let's say I have a flu vaccine, and that vaccine costs $10, and I can guarantee that it's going to give me $10, or sorry, not $10, 10 days on average of healthier time compared to somebody who doesn't get the flu vaccine. They're usually sick for an average of 10 days. If I get the vaccine, I'm not going to be sick for those 10 days. So my incremental effect is 10 healthy days, right? And it costs me $10. So it's $1 per one healthy day in that example, right? So it's $1 a day. So notice I didn't put a dollar value on that day. I didn't have to. I didn't have to put a dollar value on this denominator. Didn't put a dollar value on that day. But I know how much that flu vaccine cost me. It cost me $10 compared to treatment as usual, which is not getting a flu vaccine, doing nothing, right? So it's 10 divided by 10, that's $1 a day. All right. Our numbers are going to look a little bit more complicated than that, but that's at the most basic level what we're doing. So where did I get the data to fill out the numerator and the denominator and both sides of the subtraction equation? So I did a secondary analysis of data, so that means I didn't collect any of this data myself. That was from Dr. Jones and Emily Eisenhart at Georgia Southern, and from Transforming Youth Recovery. So I took those two national surveys and I aggregated pieces of that to create kind of an average CRP, right? So from the Jones and Eisenhart data set, I got certain information. I got information about budgets. And from the Transforming Youth Recovery data set, I got other information. I got membership size, membership within the CRP. And then from everything else, that was stuff that already existed in the literature. So got a lot of national digestive education statistics. We got some NCHA data. We used some information from the Laude study. That's where we got kind of our effect size, right? And we were able to kind of cobble together information from a bunch of different sources, but all sources that already existed somewhere out in the world. So I didn't have to do any data collection myself. Just putting it all together. So let's walk through the cost side. So again, that's our numerator, right? And we're right in the societal model. So again, that's the nation's perspective, essentially. So to calculate costs, we just looked at the total cost to society, and then we multiplied that. We just looked at the portion that's attributable to college students. So remember, college students, much higher prevalence of substance use disorder. It's almost 15%, but they don't make up the total population of people with substance use disorders. So we're just breaking out that portion that is attributable to them. And that number, that portion that's attributable to them, that's treatment as usual. That's what we're using for treatment as usual. We got our CRP budgets again from that Jones data set. We got membership size from Transforming Youth Recovery. Important quick note here, super conservative estimate for membership and participation in CRPs. That's out of necessity. The Transforming Youth Recovery data set asked people to respond by checking different categories. So when you have categorical like number ranges like that, best thing to do is to take the middle number, right? So we did that. We used that middle number as to estimate our average. However, the highest category was 51 plus. And we know that there's collegiate recovery programs with like 100 students. There's a few of those actually. So we're vastly underestimating the average size of a collegiate recovery program just because that's just what we had to work with. And we wanted to take a more conservative approach so that nobody could accuse us of overestimating or beefing up our numbers. Does that make sense? And then again, relapse prevalence, that's from the Law Day study. So our costs, it's total cost to society. It's just the portion that's attributable to college students. And then the cost of the intervention, basically we're taking that cost, that treatment as usual cost, we're subtracting out the amount that's saved by students who are participating actively in the CRP. So we've got our membership, we're taking into account the relapse rate, and we are, that's an incremental cost, so cost per person essentially. And then we're adding back in the CRP budget. So we're taking into account the average budget of a CRP as well. And for the societal model, really constrained, but the standard is to always do quality adjusted life years. So that is the perspective that governments at the societal level are used to looking at. So that's what we report for the standard effect size there. We get to be a little bit more creative and a little bit more tailored with the institutional perspective, but the societal perspective, it's pretty prescribed. This is the effect that we care about for this. So what is a quality adjusted life year? Think about this. So if you are in perfect health, your quality of life adjustment is 1. So if I have 1 year additional of perfect health added to my life, it's straight up just 1 additional year. If I am, for example, living with a serious illness, let's say cancer, and there's a treatment that extends my life, but it doesn't improve its quality that much. Maybe it improves it over the alternative, but it's still like maybe 60%, right? 60% of perfect health. So I wouldn't add a full year. I would add 0.6 of a year. Even though the time that I get is a whole year, the quality, we're going to adjust down for the quality of that life year. When you're talking about recovery, recovery tends to really improve people's quality of life, right? Really substantially. And of course, active addiction really constrains people's quality of life. So what we actually looked at was the difference in quality adjusted life expectancy. So if somebody is living with a substance use disorder, not only do you expect that life expectancy to be curtailed, you expect it to be quality adjusted down. And if they're living in recovery after a certain point, they're going to experience an increase in their quality adjusted life expectancy, right? Does that make sense? So they're getting some quality of life adjustments back, which translates into additional years of life, yes, but additional quality adjusted years of life as well, right? So to get the effect, we're looking at the difference between the two. And we're really only looking at the difference between the two for who you can attribute to your CRP. Okay, so the societal model is the simpler one. It's okay if you didn't actually think this was simple. This is sarcasm, don't worry. Buckle up, it does get a little more complicated. The institutional model is quite a bit more complicated. Whole bunch of variables that go into this one. Don't worry, we're gonna walk through each of these, okay? So in institutional model A and B, we are looking at two different types of cost. Okay, again, remember, 99% of you, you're going to want to do institutional model A. Very few of you are going to need to bother with B. Essentially, bother with B if somebody is asking you to be like super conservative, or you're at like a really, really elite school where the attitude of the decision makers is such that they want you to like not worry about lost tuition, essentially, right? So the main cost that we care about in institutional model A, we care about lost tuition. We care about tuition that our institution is missing out on because somebody had to drop out because of their substance use disorder, right? And in institutional model B, let's say we're at an institution like Harvard, right? Or an institution where you've got a line out the door of people waiting in the wings to come on in. Let's say you have an administrator who's like, you know, we have no problem recruiting students and we don't want to worry about lost tuition dollars. That's not really a thing for us, right? Because we've got such a line out the door. That's fine. Really, everybody should still care about attrition. It matters. It matters for your school's reputation, matters for a lot of things. It's not an instant replacement of a student either, right? But nonetheless, that's why I say 99% of you are going to want to do institutional model A. But if you want to be really, really conservative, if you really are at a super elite institution with a line out the door, great. Institutional model B, we're not taking into account lost tuition. Instead, we're taking into account how much it costs to onboard a new student. So new student orientation, all of those different compliance modules that a new student has to do, those are not free, right? Those are not free to create, to maintain, to administer to students, to hold them accountable for that stuff. That's not free. So it's a lot less than tuition, but we're taking into account just those costs instead. And I say just those costs, but it's not quite that simple. For both of them, we're also taking into account opportunity cost. So that's our secondary cost that we're concerned with. And we're looking at it the same across both institutional models. So opportunity costs, simple explanation, it's what I could be spending my time doing other than whatever this health issue we're talking about is, right? So again, going back to our flu vaccine example, you know, a doctor could spend an hour seeing patients with the flu, or they could spend an hour seeing patients who have other concerns besides the flu. How much money is saved in that hour if they're not seeing those flu patients because of the flu vaccine, right? They're saving a dollar amount that we can pretty easily figure out just by knowing how much they make an hour, right? How much they make by seeing X number of patients in an hour. So the same thing applies here. We've got campus personnel who are going to have to really regularly interact with students with substance use disorders, especially students who are in active substance use disorder or who are maybe in the midst of a return to use event, right? So those are counselors in the Student Counseling Center. We look at just the portion that's attributable to addressing those substance use concerns. We actually have some pretty good data on that. Student conduct officers, so dealing with alcohol and drug campus violations, also have great numbers on that, national reporting data. If you do the biennial review, you've had to submit a lot of that stuff. And campus police. We also, not every campus has their own police force. If you don't have that at your campus, you get to leave that out of your, when you use the toolkit, you get to leave it out. But for those that do have campus police officers, we did include that in the basic model. Okay. We got all of our enrollment and tuition stuff. All of that stuff's out there. We also assume that in the intervention condition, so in the CRP condition, instead of losing students to attrition, we get to keep them, and they're no longer using those opportunity costs for those key campus personnel. So we're saving that, right? So to sum up, our costs in institutional model A, it's attrition costs, attrition tuition costs, and opportunity costs. And for institutional model B, it's onboarding costs and opportunity costs. We're not paying attention to tuition, right? And in both of these, the intervention condition is whatever that treatment as usual is, and then whatever we're saving by keeping those students in our CRP. We're adjusting for relapse, and we're taking into account the CRP budget, okay? And the effect, that denominator, what we care about on the bottom there, that thing that we don't need to assign a dollar value to. We care about students that we're retaining adjusted for relapse. And that the bottom part there is just letting you know that we don't want a zero value, we don't want a negative number. So that's how we adjust it. Okay, that's our base model. Now what do we do with that? So one-way sensitivity analyses, again, we're just letting one variable vary across a range of plausible values at a time, and we're recalculating that key value, the incremental cost effectiveness ratio, for each of those points of variation. And we're repeating that for all of our variables, just going down our list. What we're doing with that is we are observing the effect that each variable has on the model. So for some variables, it may disproportionately impact our end result, while others actually have a little bit less weight. So we have more wiggle room there, essentially. I do have a handout for you. I apologize, it's a little bit out of order, but you'll get that handout link at the end. All of those sources for that range of variation, again, were pulled from either the literature, or if a range wasn't provided, we just let it vary by 20%. That seemed like a pretty good starting point. And for multi-way sensitivity analysis, again, really pretty much the same thing as our one-way sensitivity analyses, except we're doing it for all of them all at the same time. And in order to help us kind of constrain that variation, that simultaneous variation, we're assigning different probability values to each of those variables and each of those ranges. So it's more likely that things are going to kind of fall in, if it's normally distributed, within the standard deviation of the mean, right? If it is distributed some other way, then it's going to look a little bit different, essentially, like how we expect things to kind of fall out. So actually for this, we didn't really know a lot about the probability of the ranges, especially for our CRP specific data. We just don't know enough about CRPs yet to know really what that variation looks like, how it's distributed, right? So we use triangle distribution for the most part, which is just a really conservative way of saying, okay, I know my middle point, I know my maximum and my minimum, and that's all I really know. And that allows us to be a little bit more conservative as we are looking at this multi-way sensitivity analysis. And then again, we're doing a incremental cost effectiveness ratio for each iteration. And we're doing it 10,000 times. And we are then averaging out and getting a confidence interval for all those 10,000 iterations. And so that lets us look at an overall picture of uncertainty in our model. Okay, so for the toolkit, our methods, it's just an Excel spreadsheet, and you get what will walk you through all of that. But it's just the base model, so you actually don't get an opportunity to do the sensitivity analysis unless you want to do that on your own simply by inputting different values into those user input fields. So you can kind of play around with, hey, this is what it'll look like if we attract 5 students. This is what it'll look like if we attract 50 students. This is what it will look like if we have 2 staff members versus 1 staff member. You can kind of do a little bit of manipulation with that. So our results, our base case, what you really need to know here, again, remember, how do we report this? How do we interpret this? So it's negative $3,872, and that's per quality adjusted life year, because it's the societal model. So for every quality adjusted life year we add, we're actually saving over $3,000, almost $4,000. So usually programs cost money, right? Usually something's cost effective, but it still costs, there's still an incremental cost, right? A cost per unit of health outcome. In this case, we're actually saving so much that it's a negative number. So we're saving, it's an overall cost savings per quality adjusted life year. And then for institutional A, which most of you will use, again, the average is a savings of $11,000, over $11,000 per student retained instead of lost. So that's really good. Spoiler alert. Collegiate recovery programs save a lot of money, not just for society, but for campuses as a whole. And for the super conservative estimate, when we're just looking at onboarding costs, we're not taking tuition into account at all. Institutional B, we don't see a cost savings in this average case. It's $14,500 per student retained. However, note that we are below our threshold compared to the cost of treatment as usual. So highlights for the one-way sensitivity analysis, cost effective in all models across the entire range of variation compared to our thresholds that we established, but your cost saving at 10 members and above for institutional model A and for the societal model. The next most important variable is the cost of tuition. So if your tuition is particularly expensive at your school, you're probably going to be cost savings throughout the entire range of potential variation. That's a little bit more constrained if your tuition is really cheap at your school. Opportunity costs, relapse rate, and the underlying cost of treatment as usual has less of an impact on the overall model, though. And for our multi-way sensitivity analysis, all you really need to know about this is that these numbers are a little lower than in our base model, and it probably has a lot to do with the fact that we had to use really constrained, really conservative probability estimates. And as we know more about it, we'll be able to dial that in more. So key takeaway here, we really want to make sure we're balancing our CRP structure and the budget with tuition costs and with membership and participation size. And we really want to do that for campuses that are not concerned about lost tuition, that institutional model B scenario, which again, is not going to be that many of you. On the other hand, we have this really wide range of tolerance to meet the criteria for cost effectiveness and even for cost savings. So you really have a lot of wiggle room before these programs could potentially be considered not cost effective or not cost saving. A lot of limitations. Again, limited data availability because of the rapid growth of our field, limited understanding of how these data are distributed. So we used the triangle distribution to be really conservative. We've got a mismatch in some of our base case variables. So again, remember, I had budgets for programs that were really small and really, really, really big, but I did not have that same range accurately represented in my CRP membership size because I was dealing with categorical data and I needed to be conservative with that. So the average budget looks a lot bigger compared to the average CRP membership size because they're pulling from 2 data sets and they're limited by how the data were reported, if that makes sense. So, so it's definitely more conservative. And some of the base case, some of my model variables were a little bit mismatched. But as we have better data, as we continue with national surveillance efforts, we're going to be able to dial that in and improve that for sure. Okay, and again, we know CRPs are about way more than just preventing relapse. We need to know about quality of life. We need to know about recovery capital, but all of that stuff is really still developing. And so it's a little bit difficult to work with still. So this is just a start. So love to update the model as we have more CRP data and as we understand some of these quality of life issues and as we understand how these data are distributed. So now we are going to take a quick breather. I'm going to have some water. And we're going to work directly with the toolkit. So go ahead and let's navigate over here. Take a look at these handy dandy links. You might want to pause here. Go ahead and, I guess as big as it's going to let me get. Go ahead and follow these links. All of these links are case sensitive. This is going to give you the presentation slides that we just walked through. This is going to give you the toolkit. Notice there's an underscore here. These are case sensitive. Make sure to capitalize all of this. This is going to give you my thesis, which has some more details in it. And this is going to give you a handout. It's this handout. It just has all of the numbers that I used. Don't even worry about it if it makes your head spin. It's just there for your reference if you need it. But again, these, and references. So references for all of the data points. Those are also useful. So go ahead and pause at this point, pull up the toolkit. All right, and I'm going to do the same. So we're going to get that out of the way. When you enter that link in, it's going to give you this screen essentially. This is an Excel file. It's in a Google Drive. Make sure you navigate over here and download. Okay. So go ahead and download. All right, it's going to look like that. I've already got one open, so I'm just going to maximize that real quick. And let's zoom in. So take a look. Notice the tabs down at the bottom. Make sure you're in user supplied data. I think it automatically wants to open up on base model. But let's walk through real quick. We've got user supplied data, we've got base model, we've got worksheet, and we have references. You only really need user supplied data and worksheet. In user supplied data, let's take a quick overview here. So you have yellow cells. In the societal perspective, you only have yellow cells. You also have white cells, and notice this might be too small for you to read, but these are actually protected and locked. In the institutional model, you have both yellow cells and blue cells. For yellow cells, you can just go ahead and enter whatever you want in, right? I'm going to enter in 30,000. All right. In the blue cells, I could enter something in here, but there's actually quite a bit of math going on behind the scenes. So what I actually want to do is go over to the worksheet. And I'm actually going to enter in, I'm just going to walk right through this worksheet and enter in everything into the yellow cells. Again, remember, yellow cells means you go ahead and supply that information. And then it's going to automatically populate back over here. And it's going to do the math for you. Okay? So it's very handy dandy. Institutional model B is down here. And again, we've got the same setup. We've got yellow cells, you just type it on in. And blue cells, it's going to do math for you. Make sure to just fill out. Make sure this is already filled out. It's going to autofill for both of them. So you fill it out once, you're good to go. Okay. For the yellow cells, you should know this. You should have this information, or you should be able to get this information pretty easily. If you have any trouble getting this information, feel free to reach out. But I would definitely defer to reaching out within your institution first. You know what you should also try is some of this stuff, just Google it. Some stuff like institutional retention numbers, like year-to-year graduation rates, it might be another way that it's phrased. You can just Google that and that'll pop right up for your institution, because institutions report that stuff. For your CRP budget, let's say you don't actually have a CRP yet. You haven't started one yet. That's totally okay. What do you think your CRP might cost? What are you asking for? What are you going to propose? Do you think you want to have one staff person or two? You can ballpark a number based on how many staff you're asking for, what kind of budget you're asking for. Ask around. Feel free to use the ARHE listserv to get some good ballpark measurements for yourself and kind of benchmark that. But this is where you'll enter that information, and real number or proposed number. Either way is totally fine. Enter the number of students that participate in your CRP. If you're a membership model, this is your members. If you're not a membership model CRP, whatever participation number you use or that you are aiming for. And then relapse rate. Really, you can think about this as a retention rate. You're actually entering in 1 minus the relapse rate. And that it has a reminder here about that. You can use your own institution's rates, or you can use that national average, the national average from Law Day, which would be, if it's 1 minus the relapse rate of 8%, it'd be 92%, right? Again, white cells, they're protected. Don't mess with those. You can mess with them if you really want to. This is the password. Password is actually Castedo 2019. You just go to the review tab. Sorry, there we go. You go to the review tab, unprotect sheet, enter Castedo 2019, and that will let you unlock all of the cells. However, keep in mind that you might break it, and that's okay. If you break it, just download it again. No big deal, right? No biggie. Download it again and start over. And that will also unlock and let you manipulate these blue cells too, okay? Okay, so let's walk through an example. All right, let's go back to our PowerPoint here. So again, there's the link to download it. We're going to walk through an example with Matilda University. Matilda's my cat. That's her picture. It's a large state institution. We've got 35,000 students. The CRP has 25 students. The CRP's budget is $125,000 a year. Annual tuition is $10,000 a year. retention rate is 75%. Here's a quick tip on tuition. You can either use just the straight up average cost of tuition. You could use in-state tuition only. You could use, you could also do something a little bit more complex where you take the proportion of international students who have one cost, out-of-state students who have another cost, and in-state students who have yet another cost. And you can multiply those basically to get a weighted average that is exactly proportional to the number of international students, out-of-state, and in-state students that you get. So like at UT Austin, where I used to be, huge number of in-state students. So we'd want to make sure that we're matching, that it's mostly weighted, the average is weighted towards that in-state tuition cost, right? Whatever you choose to do, there's not necessarily a wrong answer here. Just explain what you're doing, justify what you're doing. You know, think about why you're doing it that way, right? Are you doing it that way to pad your numbers, or are you doing it that way to most accurately represent what's going on at your institution and what the true average cost would look like? Let's say you're a campus that has a ton of international students, and that's like really a big source of revenue for the institution. That's really important, and you want to make sure to capture that, because that's really going to make your administrators and your decision makers above you perk up their ears. They need to know that you've taken that into account, right? Okay, so that's just my quick note on tuition. Okay, if you don't know a number, again, remember we've got that base model tab, that's that second tab that you normally don't need, but you can navigate to that and pull a number from there if you need it. You can also make an educated guess, just kind of be clear about what you're working with. And again, there's the instructions on how to unlock cells. And again, can't break it, just download it again, don't worry about it. Or I mean, you can break it, but don't worry about it if you do, just download again. Instructions on that. Okay. Okay. We are going to X back out of this because now we are ready to take it for a drive. So let's do it. We've got our Matilda University numbers. Got them written down on my sticky note here. And we're going to go ahead and enter these in. So user supplied data, starting with a societal perspective. So far, I've only told you about everything in ABC, columns ABC here. We're going to get to DEF in just a second. Don't worry about those yet. Okay? But so let's enter this. My CRP budget. Remember, at Matilda University, it's $125,000. Okay? My CRP membership size, that's 25 students. And you know what? Let's say I don't have information yet on what our specific relapse rate is. So I'm just going to use that law day number. So we're going to do 92% because it's 1 minus 8%, right? And I actually don't need that, that tuition number. I don't need that retention number for the societal perspective, because remember, this is like national lawmakers, taxpayers, that kind of perspective. So they don't necessarily care about that in this perspective. Cool, so I've entered in my data, I've done my part. And if you'll notice, the result is different than it looked a minute ago. This is where I have my results in these columns, all right? So this is my numerator, the total cost of the society and total cost with the CRP, right? So that's that first number, that's that second number, we're subtracting those, that's the result of my numerator, right? And then this is the result of my denominator. Those are the quality adjusted life years we're adding, okay? And when we divide that out, this is our result. So let's remember how to report that, how to interpret that. Again, it's a negative number. So we're talking about a cost savings again. So the way that I report that out is for every quality adjusted life year that we're adding as the result of having this CRP, we're saving society $15,500. Okay? We're saving $15,000 per quality adjusted life years gained. And again, most programs cost money. Most of the time, we do a cost effectiveness analysis. We're happy if we get a nice, small, but positive number, right? So we're actively saving, and we're actively saving a heck of a lot of money. So this is a fantastic result, right? Let's go down to institutional perspective A, okay? So let's just go through this top to bottom, okay? We're starting out with the blue, so that means we need to use the worksheet tab. We're going to navigate over to the worksheet tab. We're going to start entering info. So some of this is actually already set up for Matilda University, but enter our number of undergraduate students, 35,000. Enter the first to second year retention rate. And again, remember, if you don't know this off the top of your head, don't worry, Google it for your institution. You should be able to pull this up pretty easily. And if you have any trouble finding it, contact maybe your admissions folks, or maybe some other people in student affairs might be able to help you get this info if it's not readily available. But this should be pretty available. And that is our rate, 75. Our tuition for 1 year is $10,000. Okay, and then here's where it gets a little, you get to use your judgment a little bit, right? So the estimated attrition that is attributable to substance use, so people dropping out and not coming back because of their substance use, it's between 10 and 20%, okay? That's the range that's reported, that's out there in the literature. You get to decide if you just want to use a middle number, if you want to be conservative and use the lowest number, whatever value judgment that you want to go ahead and make. I am going to go ahead and continue the trend of using that central tendency, so I'm going to use that middle number, okay? Use the mean. So that's going to, we don't have to worry about this, but it's auto-populated everything back on our main worksheet, and this is just our lost tuition numbers, okay? Here's where you may need a little bit of help, but this is where we're looking at opportunity costs, okay? And remember, I didn't give any of this for Matilda University, because you might have a little bit of a tricky time finding it. You might be able to get that info easy peasy from HR. Just depends on your institution. What I have in here in the boxes already is the mean pay for student conduct workers, for counselors, and for campus police. And this is from national figures. You can ask HR, or you can see if maybe there's like a accountability office in your state that tracks things like this. There happens to be for Texas. You can look at within institution average pay for different positions. So you can, or it might be a median as well, so you'll just want to double check, but go ahead and grab a central tendency number. Mean is best, of course, because that's what we're working with pretty much across the board. So we're going to leave these alone for now, but let's say that you're able to get these and you can enter in whatever that hourly pay breaks down to. Even if they're salaried, go ahead and translate it into hourly, okay? The number of student conduct cases involving alcohol or other drugs at your institution in 1 year. You should be able to get this as well, because that's going to be part of, you might have to report that, right? So that's going to be from your student conduct office. So let's say we had 500. And the number of student counseling appointments. So you may be able to get this from your counseling office. Hopefully they're tracking that. If not, go ahead and that is going to, in the base model, we've got a we've got that already calculated out. Basically, it will calculate this out as a percentage of the enrollment numbers at your school, because this is not necessarily reported to national numbers, but what we do have instead is, what we do have instead is, here's the average number of, the average percent of the student body that a counseling center serves. And then of that, here's the average percent that are attributable to substance use and the average number of sessions that they might encounter. So it's a little bit more convoluted than the other ones because it's not a standard way of reporting it, but hopefully you can work with your counseling office to just get these numbers. And let's call that a nice even 1,000, okay? And then campus arrests involving substance use. Again, these should be reported if you're up to date on your biennial reporting. If you don't have campus police, go ahead and just leave it blank. All right. And then we have per student opportunity costs, total opportunity costs, total number of cases, right? And we'll see that change if, let's say, we do have 20 campus arrests, right? And we also see that populate back over here. This has changed, all right? And again, we're gonna have to double dip a little bit on some of this stuff. So here's our cost for tuition again. I already entered that over on the worksheet, but I need to make sure I'm entering it here again too. We've got 35,000 students. My CRP's budget is 125. Number of students is 25. Relapse rate, we're going with 92. Enter the same number used for overall retention. Again, sorry to make you double dip, but I'm not a sophisticated enough programmer to create anything other than an Excel spreadsheet for you. So you'll have to double dip a little bit. And then again, that substance-related attrition, we went with 15%, so that's what we're using here too. Okay, and then over here, we've got our results columns, right? We've got, this is all of our numerator stuff. This is our denominator. All right. And so again, interpreting this result, negative $4,000, $4,500. That means that we're saving $4,500 for every student that we retain instead of losing to attrition. Again, most of the time when we're talking about programs where we're actively able to save a student from attrition, we're talking about a cost per student, right? In this case, we're actually talking about actively cost saving per every student that we retain. So this is really important stuff here, right? And you can compare that to like the cost per student for some other programs that maybe don't have as dramatic results as this. And yeah, we're talking about negative dollars cost savings per student retained. That's really impressive. Okay, so institutional model B, again, remember, most of you aren't going to have to use this one, but if you want to, again, we don't have to fill out the worksheet again. It's already filled out. It's already done. We're good to go on that. So it's already populated that, but we are going to have to double check that we have everything in the yellow cells correct. So the first one, again, you probably can't Google this. So you're going to have to reach out to whoever is responsible in your campus for onboarding new students. So whatever that looks like, is that new student services? Is that orientation? What is that called? And kind of try to get a sense from your colleagues what all goes into that. So is it going to be as simple as the budget for their office? Or does one office do a little bit and another office does a little bit and another office does a little bit? And are you going to have to kind of get the costs of those three things combined? So do a little bit of digging. You can feel free to use, this should be the national average, this 306 number. If you go over again to the base model, you've got all of the base model parameters, right, in this column C here. And you can see the source in column D, right? And we've got some variation estimates too, but you don't need to necessarily worry about, we don't have them for everything. So kind of might want to stick with the average. So you can get that average from here. Again, for orientation budgets, it's this 306 number. But if you happen to be able to get it for your institution, awesome. If not, just go ahead and use that average. This is just going to this will actually auto-calculate for you, but you can also do it yourself. But so let's say we're going to change this to, my school's pretty big, and so it's a little bit higher than average. For $400,000 is my new student orientation budget. And again, we've got 35,000 students at Matilda University. So it automatically calculated it for us. But we could also, if this is just the number that your contacts have, like they may have it figured out as a per student cost, that's great. You can also just delete what I have here, this little equation, and just enter whatever that number is. So that we'll left that flexible for you. I didn't lock that cell for that purpose because your school may report it as a per student cost. Okay. So again, we're just double checking that we've got all the right numbers in. And sorry to make you do it again. Okay. All right. And again, this is pulling that from that worksheet, so we don't have to change that. So now we're ready to look at our result for institutional perspective B. So for every student that we retain, again, we are not caring about tuition. We're only caring about onboarding costs and opportunity costs. It costs us $5,300 per student retained. So again, this is the most conservative estimate. That's why we're in the positive numbers instead of in the cost savings zone. But if you'll recall, based on our cost effectiveness thresholds that we were looking at earlier, $50,000 and $15,000 to $22,000, we're way below that. And we can compare that to some other programs that are aimed at retaining students. So we have, even though it's a positive number, it still definitely meets our criteria for cost effectiveness, definitely meets those thresholds. It just isn't as dramatically positive and cost saving as our other perspectives of looking at this. Okay. So to wrap up this walkthrough, let's see, there's another link to the thesis if you need to look up anything else. Base model, again, if you need to look up any numbers, otherwise, it's just going to look kind of like a big scary spreadsheet. Don't even worry about it. Just stay away from it. Go to the worksheet and the user supplied data tabs only if that's where you feel most comfortable. And then the references tab just has the full references for each of those variables, the source for each of those variables. Okay. So we're going to move this out of the way. We're going to go back over here to the presentation. And again, I gave you these links up towards the beginning, but let's just go ahead and repeat them. We've got the toolkit, we've got the thesis, we've got the handout. The handout is those tables and also the full list of references, right? And also my email address, sierra.j.castedo.martell@uth.tmc.edu. Happy to provide technical assistance. If you have any questions, go ahead and check out some of these resources. Let me show you what they look like. This is the thesis. When you follow that thesis link, this is what it's going to look like. Please note that the thesis actually does not have institutional model B in it yet. It is just societal and institutional model A, because we added B for the version for publication. So hopefully coming down the pipeline in the near future will be a published article that has both models, both institutional models in it. but it's not in this version. But again, so few of you are going to really need that version that it shouldn't matter. This is not behind any kind of paywall, so this should pop right up, by the way. Again, this is what the screen looks like when you follow the link for the toolkit. Make sure you download, right? Download. Exit out of that. This is what it looks like when you follow the link for the slides. Again, make sure you download. And then this is what it looks like when you follow the link for the handout. The download link looks a little bit different because it's in Dropbox. So you want to go to More and then Download. Okay? We'll exit out of that entirely. And again, thank you very much. Here's my contact info again. As many of you may know, I'm expecting my first child imminently. Again, feel free to email me. I would love to hear from you, hear feedback about if you found it useful, if there's anything that tripped you up and that you could really use some clarification on. Just know that I may be a little bit delayed for the first few months of 2020 in responding. But hopefully some of those other resources that I gave can tide you over until I'm able to respond. Yeah, I hope this was useful. I hope you can use this in your advocacy efforts to support your existing CRP, to dial in your operations and improve your own efficiency of your existing CRP, or to successfully advocate for funding of your CRP or institutionalization. Please let me know how these efforts go, and if it's been a useful tool for you. It would be really helpful to hear some feedback if you've found it useful, or if you haven't found it useful, what some of those critiques might be, and how we can continue to improve this tool. So thanks again, and take care.